It's go time. All right, good evening. Before we begin, if you wouldn't mind, everybody please stand up. I just want to make sure I have the right information for the right audience this evening. Go ahead, please stand up, thank you. Out of all of us here tonight, if you or a loved one has ever been affected by cancer, please sit down. If you or a loved one has ever been affected by heart disease, please sit down. If you or a loved one has ever been affected by medicine, an unneeded surgery, vaccination, or the medical system, please sit down. Look around the room. When is enough enough? The top 3 leading causes of death here in America today are just that. Number 3 is cancer. Number 2 is heart disease. Number 1 is iatrogenesis, meaning death by medical malpractice, medical error, overprescription, botched surgery, or overutilization of the medical system. If we were to look at VAERS, the Vaccine Adverse Effect Reporting Agency system, less than 1% of the deaths and injuries are reported. So that means over 99% of the injuries and deaths are not even reported to VAERS. If we were to combine statistics of VAERS with iatrogenesis, I firmly believe that they would far exceed the death toll versus cancer and heart disease combined. What we live in today is a crisis healthcare system. We also have been experiencing a shift in healthcare, where we have the mother down the street who walked out of the pediatrician's office because they did not respect her autonomy for her child, her request to not vaccinate. We the people have spoken, and we have been heard. Over the next 19 minutes, I get the privilege of sharing with you tonight what I believe to be the greatest message in health. A message that personally has changed my life, and having a private family practice, I get to see that message change other people's lives too. Tonight we're also going to get into the topic of how we talk about the vaccinations with our patients. Okay, my goal is to bring you some value that you can use, some tools to talk to your loved ones about the same topic. Now, the reason I'm so passionate about being part of this movement and being here tonight is, for me, my story started, I grew up medicated, vaccinated, and sick. I was 5 years old, sitting in a cold oncology room at Penn State Hershey Medical Center. I heard a knock on the door, and in walks the doctor. He looked at my parents and said, "I have bad news. Your son has leukemia." "Not my child," said my mother. "Is this the way he was born? Or are these the cards he was dealt? Is this the way it's always going to be?" So they recommended chemo and radiation, and after a couple months passed, the doctor came back and said, "We were wrong, it's not leukemia, it's ITP. It stands for idiopathic thrombocytopenia purpura." So essentially what that meant is they feared that if I played sports and hit my head, I could eternally bleed and die. So growing up, I was limited. I couldn't play contact sports. I had to sit on the sidelines at gym class. If I did want to participate, I had to wear a helmet. I remember in the heat of the summer wearing long sleeves and long pants, going to school because I was embarrassed of the bruises on my arms and my legs. Now at the same time, my brother received a diagnosis of autism. That was back in the late 1990s, where the autistic rate was 1 in 1,500 kids. Fast forward 25, 30 years later to today, it's 1 in 36. 1 in 36. So for my parents at the time, that was hard to juggle the 2 diagnoses. Well, my mother was seeking for answers and truth. And she brought me when I was 12 years old to a principled family chiropractor. And this principled family chiropractor started to educate me on how my body is designed to function and how my nervous system controls all the health of my body. What he said made sense, and I started to see results. My headaches started to go away. My recurrent ear infections started to clear up. My allergies healed. But one of the biggest improvements I noted in my health was my blood work started to normalize. I started to get up into the points of normal levels where I no longer had that gray cloud of diagnosis over my head anymore. I got excited about this. It inspired myself to become a family chiropractor. So I went off to school, and during my time at chiropractic school, I took a specific interest in the connection between autism and chiropractic. Now, my last year of school, I met a girl at a restaurant, and she asked me the question, "What do you do for a living?" I said, "Well, I'm aspiring to be a pediatric chiropractor." And she's like, "Well, that's cool. I work with kids." I said, "What do you do?" She said, "I'm a nurse practitioner. I see kids with cancer. I give them chemo and radiation." I said, "That's awesome. Very noble. Let me ask you a question. Do you vaccinate those children?" She said, "Yes." I said, "Do you see kids with ITP?" She said, "Yes." I said, "Do you believe vaccines cause autism?" She said, "Oh, no. In fact, that science has been debunked a long time ago." Would you guys agree that if a nurse practitioner is confused about what health is, other people can be confused too? I mean, I see it pretty regularly in our office where people come in not knowing what health is. And I always ask the question of what is health? And fundamentally, the two common answers I get is, "Well, doc, I know I'm healthy because I look good or feel good." People feel good every day and have heart attacks. They feel good every day and they're chock full of cancer. A lot of the literature shows we don't actually feel the effects of cancer until it's in our bodies for roughly 7 to 10 years. And same with heart disease. Most times heart disease isn't even diagnosed until that person first has a heart attack. So if we base your health off how you feel, we're missing the boat on what health is. That's a lot like saying if it's not broke, don't fix it. If I feel fine, I'm healthy. And if I do have a symptom or a pain, then maybe, just maybe, I'll take action to do something about it. So if health isn't about how we feel, it's about how we function. And what controls all the function in the human body? It's our nervous system. Brain, spinal cord, and nerves. Our nervous system controls and coordinates everything. For our heart to beat, lungs to breathe, food to digest, hormones to regulate, every single thing happens through our nervous system. So every single person out there knows that the brain controls it all. Most people know that the job of the spine is to protect that nervous system. What a lot of people don't know is what the nervous system actually does, its main role. Let me give you an example. If we had a room full of students and they all went outside, and say it was a day when the pollen count was really high. Some kids would cough, sneeze, get watery eyes. Some kids would breathe the same air and be perfectly fine. My question to you, is it the pollen or the body's inability to adapt? The World Health Organization, love them or hate them, said that the #1 cause of cancer, heart disease, chronic illness is stress. Stress. But I'd argue it's not stress, it's the body's ability or inability to adapt to that stress. And that's where our nervous system comes in play. The main job of our nervous system, guys, is to adapt to stress. Adapt to the external and our internal environment. It's kind of like a filter. If the spine is aligned and moving well, our body can filter the stress we're faced with. If the spine is stuck and not moving well, the body cannot function at its fullest potential. We cannot adapt how we're designed to. Now, a lot of times we ask the question of what causes that stress on our nervous system. There's physical, there's emotional, and there's toxic. The physical are slips, falls, sports injuries, and accidents. The emotional, dog dies, taxes due, rent payment late, loss of a loved one. Toxic stresses are things we put in our body that aren't the healthiest for our body. Red dye 40, fluoridation of our water, medications, vaccinations. The literature shows that the number one largest stressor on the human adult nervous system is the emotional stress. The literature also shows that the number one stressor on a newborn's nervous system today is the toxic stress, the current vaccine schedule. It's a total of 73 shots for 17 diseases. 28 of those received within the first year of life. 28. In my mind, that's not health care, that's sick care. And that's not setting up our future generation for a lifestyle, but more of a death style. We see babies coming in the office, I look in their eyes, they're clear, they're connected, and they're healthy. We also see babies coming into the office, and I look in their eyes, and something's off. Their tone is different. Their reflexes are aberrant. They're arching their back. They're irritable. Something's off. And my first thought is that child vaccinated? What type of stress is on their system that they cannot adapt to, where their body has to manifest a specific symptom as a result? We had a boy that came in, 6 years old, used to walk, used to talk, used to play sports. Got the MMR vaccine. Couldn't walk, walks on his tiptoes. Couldn't talk, uses high-pitched squeals to communicate. Can't play sports, started to have seizures. You ask mom, what was the cause of her child's decline? She said it's 100% vaccination. You see, when mom brought her son in searching for answers and hope, she was doing everything she needed to do at the time. She was doing physical therapy, occupational therapy, chelation therapy to filter heavy toxins out of the blood. Now, although those were all good and it was healthy, it didn't directly heal the body. So understand there's healthy things we can do, but it doesn't directly heal the body. If I cut my finger, it's not the Band-Aid, Neosporin, or iodine that heals it. The body heals from within. So we took the perspective of how can we strengthen his nervous system to get his body to better adapt. And as we did that, he started to improve. He started to show better scores at his physical therapy, at his occupational therapy. Chelation, guys, you can chelate the liver, the kidneys, and blood all day. But if you fail to neglect the nervous system, the system that controls it all, then that child will not get the fullest outcome when it comes to their health. You see, at the same time, he was trying to receive a label of autism. I believe labels aren't for kids, they're for soup cans. They seen him as autistic, we seen him as healed. If you have a child that's born with a missing part of their brain, that's always going to be. But if you have a child that's born capable, able, and healthy, they get a vaccination and start to decline, I believe they can heal. If it once was, it always can be. So we took that perspective and we watched his health transform. And his mother said, in years of not being able to speak to communicate with my son, he was able to muster together 3 words. Mom, love you. Mom, love you. Guys, that's my why. That's what excites me, and that's why I'm so grateful to be a part of this community. How do we talk about this topic of vaccinations in the office? Well, there was a study done in 2021 that showed why people receive the COVID shot. 3 reasons. Fear, frustration, or not knowing any different. Number 1, if you fear the virus, you got the shot. If you were frustrated, felt coercion from family, friends, or coworkers, you got the shot. If you knew no different, meaning you were led astray by your doctor, or a doctor didn't follow the true science, you got the shot. We use the same exact framework in our office to educate our patients. Now, we're not big advocates on educating through fear or frustration. You can fear somebody into the ingredients. You can fear somebody into the adverse effects. Or you can frustrate them, getting them really mad about big pharma and how they're out to keep our kids sick. But what we found is fear and frustration is not the best method. Instead, people come in and they have a different understanding at a different level of the topic. So our goal is to meet them where they're at through empathy and love and meet them where they could be. And how we do that is we share books, magazines, websites, and literature. If you never had the opportunity to read Dr. Hooker's book, Vax on Vax, incredible resource. I share it all the time in the office. Or Mary, I heard her speak tonight. If you guys have yet to subscribe to the Defender newsletter, please do. Incredible resource. In light of time tonight, I can't share exactly everything that we do, but I will tell you this. It's not one conversation. It takes time. It takes relationships that are built on trust. What I'm doing tonight is I'm giving you a gift. I had my team compile a document that has all the resources that we recommend to our patients. So if you're interested, all you gotta do is text the number. Pull out your phone and we're gonna text MAHA to this number and you will receive that free gift. The number, who's ready? The number is 561-396-9872. Again, text MAHA, M-A-H-A, to 561-396-9872. Again, that's a gift for you, and I hope it brings you value and resources to talk about this topic of vaccinations to your loved ones. You guys remember that nurse I told you about, the one I met at a restaurant? The one who was a pediatric oncology nurse, who vaccinated kids with cancer, who vaccinated kids with ITP like I once had? Well, she became my wife. And we're married 9 years. We have 3 beautiful children, all of which were born at home. One in the pool, one in the bed, and one in the tub. None of them 3 have ever been vaccinated, nor ever will be. So would you agree that if a nurse practitioner can change their view and become the biggest advocate for freedom of choice, other people can too? I do. You see, we're all leaders, and the term doctor means teacher. So the momentum's on our side, the tides have already shifted, and I encourage you as a leader, the job of a leader is to intercept the paths of others and let them know they matter. So be bold, be courageous, share this message with love. People are praying to hear this. Because when you're committed to a cause bigger than yourself, you can only help but change the lives of others. Thank you. I missed one point.